In this video today, we're going to talk about spinal cord stimulation, but more importantly, we're going to talk about spinal cord stimulation in the context of how it really works. It's not just talking about placing a lead in or putting a connection to a box, but really how do we craft it so that it's able to really be able to address pain and really be able to be personalized towards that person, where they feel it, how they feel it, so we can get a better result. And to do things like that, what we really need is to make sure that we have our programming dialed in so that it is correct and that it is treating pain and it's being able to deal with those impulses that we feel and sense in order to get the best possible outcome. In order to really be able to deliver a message that is accurate and that really can be nuanced with understanding, I have the pleasure of having a guest who's phenomenal and has joined our channel previously, and she was great at that time and continues to be phenomenal within the context of our practice. And that's Hannah from Boston Scientific, and we really like to welcome her to the show. Thank you so much, Hannah, for joining us. So Hannah, you know programming, and we really want to kind of lean upon your expertise in terms of explaining to us what the spinal cord stimulation programming all have to do and really what does it mean. But before we even kind of get into all that nuance, can you just tell us what spinal cord stimulation is for patients as general, as a background understanding?
Yeah. So spinal cord stimulation, we call it SCS for short, is a safe, it's FDA-approved drug-free therapy that utilizes stimulation to interrupt or mask these pain signals before they reach the brain. And the way we do this is, as Dr. Lambert mentioned, they're through real thin wires, or what we call leads. Sometimes you'll hear them called electrodes, and those are connected to a generator that are placed in the epidural space, and that's where the stimulation takes place. So we're stimulating those nerves to interrupt or mask those pain signals.
Okay, so traditionally when we are doing spinal cord stimulation, there's normally a trial phase and there's a permanent phase. And I'm not sure every patient is aware of that and what that really means. So just so that we're on the same page and people can really kind of get some sense of that, can you give us an understanding of the difference between the trial and the permanent, particularly from the patient's experience?
Sure. So just kind of as it sounds, the trial phase is a trial. So similar to test driving a car, you get to test drive the device prior to undergoing a surgery. So that's a common misconception, is that it's a surgery right away, and it is not. Typically, the trial phase is about a week long. So you undergo a procedure. It's very similar to an epidural. So you won't have any incisions. Those thin leads that we just talked about will be inserted through those needles, and then they will be externalized. And what I mean by that is they will be essentially poking out, and we will tape you up really good, and we'll connect you to a generator that looks like this, and you'll wear it on a belt. And this generator is what causes that tingling sensation, or essentially the nerves to be stimulated. You're able to manipulate that therapy via a remote. So you'll be able to essentially really try out the device before you get it. At the end of the week, if all goes well, we're looking to cut your pain in half. We want you to do well. We want you to be able to, say for sure that this is something you could benefit from long term. If that's the case, we then schedule you for the surgery. The surgery, in a nutshell, is very similar. It's essentially the same, except now everything's placed under the skin. So you have two small incisions, one where the lead goes and then one where the generator goes, and that's about the size of an Oreo cookie. We stitch up and you're good to live your life. Most of our generators are rated for 12 years. So it's a long-term effective solution for chronic pain relief.
Thank you, Hannah, for giving us that summary and giving it really kind of in a concise and detailed way for everybody to be able to understand. I appreciate it.
Yeah.
So one of the things that we're really looking to kind of hammer home in this particular video and talk and question and answer session is the aspect of programming.
Yeah.
And I think many times patients just think, oh yeah, it's like a TENS unit, you cut it on, you cut it off, it works or it doesn't. So without me being too glib here and kind of like ad-libbing, well, what's the big deal? Can programming be neglected? I mean, is it really even all that important? Can you tell us a little bit about that?
Sure. So programming can absolutely not be neglected. So similar to how if you get a prescription for your pain, in order for that pain to go away, you need to take that prescription. So the prescription in this scenario is that programming of the device. So the programming is done by us. So we're your care team. So we typically, when we're programming, we're asking you, where are you having your pain? And then we're tweaking the device essentially to cover that pain. So if you have low back pain, we're programming it to your low back nerves.
So can you explain the different types of programming? Is all programming the same? I mean, how complex can it possibly be?
So it can be pretty complex. So there's over 200,000 different combinations for us to, be able to program for each patient.
I'm sorry, did you say 200,000?
200,000 different combinations depending on the device and lead we choose. So there's so many different ways for us to stimulate your nerves. And sometimes it makes it challenging for us because we have a week to figure it out. So the two different main buckets, I would say, of stimulation are going to be perception and sub-perception programming. So perception programming is what we call traditional paresthesia, or a tingling sensation. Patients may say it feels similar to a TENS unit or champagne bubbles inside of them. This is the programming that you feel. So the goal with the paresthesia-based programming or the perception programming is we want you to feel the tingling in the areas you have pain. If you don't, that's okay too. You can still get pain relief. But this has been around for, over 40 years. It's kind of not an outdated therapy, but it's not what we go for traditionally first. Patients tend to like the feeling. They say it's soothing, but there are newer programs, and those are going to be our sub-perception programs. Sub-perception meaning you're not perceiving them, so programs you don't feel. The sub-perception programs work very differently. So similar to how different medicines like ibuprofen doesn't work the same as Tylenol, same with the sub-perception programs. It just works different on the spinal cord.
Okay. So 200,000, two different buckets. Question for you. So is it a certain feeling that the patient either likes or doesn't like why they would pick perception versus sub-perception? Or are there certain types of problems that might be a better solution from either of those two?
Sure. So I think it's patient preference. So sometimes with the perception programming, the paresthesia that you feel with different movements, it can increase or decrease. So the stimulation sensation you feel can go away or get intense. And that's because those leads in your back with different movements, they compress or get further away from the nerves, which essentially causes you to feel like the stimulation is changing. Some patients are more sensitive to that, so they would prefer not to have to feel anything at all. And I would say the average patient at this point is kind of moving towards the sub-perception, but maybe turning on these perception programs at night to get kind of a massage, or it helps them go to bed. So it really just depends on the patient. And we try and figure that out throughout the course of the trial, but you get to go home with lots of options to see what works for you and your pain, just because everyone is different.
Okay. So it sounds like sometimes you can even be able to blend and add these different things. And
Yeah.
what I think many patients don't understand is that frequently when you think about spinal cord stimulation, it's the concept that perception is the only thing that's offered and you have to feel the tingling and buzzing.
Mhm.
But nowadays you can be able to use something like sub-perception to be able to improve and maybe even kind of diminish the pain enough that you're not even remotely aware, but you don't have to feel the tingling. Is
Yes.
that what subperception is, kind of?
Yes, yeah. So you actually don't even perceive that anything is on. The only difference is that you're noticing your pain relief. So it may be a little bit confusing because you're looking to walk out of there feeling this sensation because that's kind of what we've known for a long, long time. But these newer programs have shown to be super, super effective, and that's kind of what we're moving towards in the neuromodulation or spinal cord stimulation arena, just because the pain relief outcomes have been great for patients.
Okay. So, this is cutting edge pain relief. So, what we talk about is the cutting edge, really innovative topics that are out there. And we're talking about subperception, which is pretty new.
Yeah.
But now we're talking about another type of treatment that is even newer and potentially more effective. So, this is kind of that little golden nugget,
Yeah.
right? So, there's something out there now that's called fast programming. Can you tell us what fast programming is about without obviously revealing the secret sauce about all the nuanced pieces? But what does fast mean? Is that an acronym or something?
Yes, so great question. So FAST is fast acting subperception therapy. So a fast acting therapy that you don't feel. So the reason this is so groundbreaking is traditionally there was what we called a wash-in period for subperception therapy. It could take, 1 to 3 days to reach your peak pain relief. And that with fast has essentially gone away. So we're able to deliver profound pain relief within minutes with fast therapy, and it's through a completely different mechanism of action. And for any of those of you tuning in who are not sure what a mechanism of action is, that's essentially how something works. So Tylenol works different than ibuprofen. This is completely different. It's a different mechanism, and that's through, like I said, surround inhibition.
I love the way how you broke that down, but then you got fancy at the end too. And it was kind of cool. You explained, what it is, and you talked about how it really impacts. So the question I have for you is many patients and individuals as a whole would be like, well, what if I want it all?
Yeah.
What if I want to, I don't know, I'm kind of going to mess up here a little bit, but what if I wanted a Kardashian it and I want everything, right? If I wanted this and I wanted that and I wanted this, can I have it? Or is it more like, you know what? No, you get to go home with one prize. That's all you got. Get off the game show. No ability for you to be able to have more than one item. Is it something where you might be able to blend or have little different types of programs at all?
Yeah, so that's a great question. So, traditionally, patients only got to choose one program. So, with the newer devices, we actually have the ability to combine those and run two programs at once. And I know I've been making analogies with different pain medications, but it's essentially picking two different programs that work differently on the spinal cord. They're delivering pain relief in different ways, and we're able to run them simultaneously. It's essentially like taking ibuprofen and Tylenol together. So you're getting the dual benefits. And that's essentially what makes it super unique. So we're able to attack that pain from different avenues. And Dr. Lander brings up a really good point. So we obviously want to give you everything we can, but we also need to be realistic in that we have a week to figure out if this is a therapy that's going to work for you long term. So you may not get all the options that we can give you right away, but just know that is an option at your permanent implant. We're more so curious during that trial phase, does it work? Does it not work? And then at the permanent implant is when we're really fine tuning it.
Okay. So with that, and you got these different programs, different types of stimulation that's in place.
Yeah.
Are the energy requirements the same for all of them? And to that end, does it affect different nerves differently? What's the scoop with that? Can you give us some ideas about that?
Yeah, so different energy requirements for sure. So every program is going to either use less or more energy. So with our high frequency or high rate programming, we call it, those tend to generate, more energy. So patients have to charge more frequently. And what I mean by charge is the device you get, as I mentioned, the permanent implant requires an external charger that charges you. And then there's also the remote that I had just previously showed you that also requires a charge. But different programs, so the FAST program we just talked about is super energy efficient. We try and really individualize it to each patient. So we will generate what's called an energy usage index just to make sure the programs we run are going to be efficient for the patient and they're not going to have a huge charge burden, but that we're not compromising pain relief either. So that's kind of the main difference. As for different nerves, yes, we can target, different pain areas if that's what you're asking. So if someone has back pain and they also might have right foot pain, we can target both of those areas at once. It may generate a little bit more energy, but generally speaking, it's very energy efficient to where you won't have to charge as frequently.
Wow. So the best of both worlds, longevity as well as good relief at the same time. It feels like, we're kind of creating a fairy tale over here, but it's going to progress and get a good result. So we actually have an incoming question that is asking about, can patients be able to reprogram on themselves, reprogram on their own? But before we get to that answer, what we're going to do is take a quick break from our sponsor. So for those of you who are joining us late, I'm Dr. Orlando Landrum with Cutting Edge Pain Relief. And today what we're doing is we're talking about spinal cord stimulation, but we're giving you the nuts and bolts behind how it works, right? We're explaining to you what is neuroplasticity, what it means, how to be able to understand how that affects your pain, how that lets you be more functional. And really what we're talking to you about is some newer cutting edge, if you would, stimulation that talks about fast protocol, sub-perception, and how that makes a difference for you. If these are topics that you think you'd like to know more about, please sign up for our newsletter, as you can kind of see at the bottom of our page that tells you where to go, how to sign up so you can get both in print as well as video, topics of understanding for pain relief, things in regenerative medicine, things in neuromodulation, things in integrative medicine and functional medicine, and how to be able to really kind of take back your life, punch pain in the face, and get back to leading your life that you deserve. If you like videos like this, I would also say, if you can't catch us live, please tune into our YouTube channel where we actually keep these videos stored so you can be able to come back and reference them. And you can really be able to say, you know what, hey, I wanted my sister to see this, or I wanted to have my spouse be able to see this, or hey, I wanted my dog to be able to see this, because I'm really interested in figuring out how this all connects and have my support system that's with me. So what we really want you to be able to do is to know that you have options, that you have options for pain relief. That's not just 3 different things, steroid injection, therapy or surgery. There's other things that are out there, and we really want you to be able to get a full, knowledgeable sense so that that way you can help make decisions in an informed way. Today, I have the pleasure of really being able to have one of the best individuals to talk about neuromodulation with me, and that's Hannah from Boston Scientific. And what we're about to do is answer a question that was posed by one of our audience members. Hannah, again, thank you so much for joining us.
Yes.
We really appreciate you being here. As I gave you before, we wanted to applaud you being here with us today. Thank you. And one of the questions that we had coming in was the following is, so can a patient be able to reprogram on their own? Any ideas about, and I'm sure that may vary possibly from system to system, but just speaking within the context of what you know, can you tell us a little bit about what your thoughts are?
Yeah, so I think that's a great question, and I do get asked that frequently. So this remote that I showed you, so there are some functions on it that allows you to be able to do what we do when it comes to location. So say you're programmed for back pain, there is a way for you on your remote to broaden that stimulation or condense it, to change the way that it feels. So if you want it to be more thumpy, you can turn down what's called the rate to where it feels more thumpy. You can turn up the rate, which causes it to feel faster. I had mentioned broadening or condensing. So that's changing what we call pulse width. So sometimes if you want to pull stimulation out of your legs, you can turn that down, or you can turn it up to move it into your legs or down to your toes. So you have the ability to do that on your remote. You don't have all the functionalities we have on our computers, but the ability for you to be able to mess with that at home is definitely an option. I hope that answered your question.
I'm pretty sure it did, and if it didn't, I know she will ask a few more, which we actually want. We want people asking questions. We want to be able to answer the things that really have you kind of perplexed, so that way you can be able to get the answers that you need. So I know a lot of people that have come to me after previously seeing another provider, and they've had a spinal cord stimulator implanted, and they only had programming at the time that it was implanted. Can you give us some idea about, does program last indefinitely? What's the scoop with that?
So it's different for every patient. So I would say the average patient, though, is meeting with us periodically to have reprogrammings or adjustments. I have had a few patients who have had, their program since day one of surgery, and that's okay too. But really, when it comes down to it, we want to make sure the programs you have are helping with the pain that you have. So it is normal. And the neat thing about spinal cord stimulation is if you get your device for your back pain and 5 years down the road you end up having knee pain, theoretically we can target a new pain area with just a simple reprogramming. And that's just a matter, and when I say reprogramming, that's just a matter of meeting with us at the doctor's office. We connect with our laptops. We're generally in there with you for 15 to 20 minutes, asking you questions like, where's your pain? Where are you feeling the tingling sensation? And then programming the different programs accordingly.
Okay, so in talking earlier, I think you might have broke out some physics terms from high school physics. So we want to make sure that we got that full gist of understanding. So not everyone is as fancy as you guys at neuromodulation and spinal cord stem companies. So can you give us an idea about what really is pulse width? And then what's frequency?
Okay.
And why does any of this stuff matter?
So it matters a whole lot. So pulse width is really just like an elapsed time between the edges of a pulse of energy. So that's essentially how many nerves too it can be recruiting in that designated time. So that's why when I say a larger pulse width can recruit more nerves, which is why you may feel it in broader areas. Condensing that pulse width, again, is essentially recruiting less. So that's kind of the idea behind pulse width, and that's why when you're able to program it, you can feel the differences. Rate essentially is how quickly that is going. So in the past, rate has kind of been consistent. It's just like this consistent beat, but the higher it goes, the different effects it has on the body. So without getting too technical and confusing, there are just different ways these rates affect the spinal cord and how it interacts with the pain signals before they reach the brain. I hope that answered that.
Okay, so sticking with just the context of spinal cord stimulation,
Yep.
what is one of the things that really surprised you about programming and the results that you got that you didn't really expect?
Yeah. So I would bring into this fast therapy is essentially brand new. So we just launched it last month. We're so used to these sub-perception programs.
I'm sorry, Hannah. Did you say you just launched it last month?
Yeah, so it's brand new. So we're still learning about it, which is super exciting. So this, if we want to talk about cutting edge, this is it.
There you go, Hannah. All right, keep going.
Love it. So so fast, as I was talking, is so different than what we've been used to in the past because these sub-perception programs took so long to wash in before we knew if patients were going to benefit from it. So it could be 3 days during a trial before a patient's like, you know what, this is really working, this is helping. Whereas fast, we're in the room directly after the procedure, and the patient knows within a couple of minutes, like, holy moly, my pain is substantially better, or I don't have pain. It's something I didn't expect to be able to witness, and it has been so rewarding. Dr. Landrum will tell you I cry all the time because I find this so rewarding. And I just take this job so personally, and it's just super rewarding to be able to offer that to people who have been struggling for so long.
Okay, so what's a common myth about spinal cord stimulation, and how would you go about debunking it?
Yeah, so I think the biggest thing I run into with patients who have been through back surgeries, or they've just been through the ringer when it comes to their pain, and they don't want to go through something that's permanent. And the unique thing about the spinal cord stimulator is it's completely reversible. So it's not like a fusion where you have this hardware and that hardware has to stay there. So say, you get the spinal cord stimulator for your pain, but by some miracle, your pain goes away. The stimulator can be removed, and it's like you didn't have, a stimulator to begin with. Obviously, you'll have the small incisions, but in general, it's a completely reversible therapy.
Okay, so we have another question coming in,
Yeah.
and that question is how often, if ever, does it need to be replaced?
Oh, that's such a good question. So it depends on the generator we choose. So we've got two options. We've got one that you charge, and those last 12 years or more. I've had some systems that were rated for 5 years, and I've seen them last 12. So, but on average, those last 12 years. And then we've got non-rechargeable options that last anywhere from 2 to 5 years. And we just kind of pull those reports based on each patient, and then we pick which one we think you'll do best with.
Hannah, again, thank you so much for joining us.
Yeah.
We really appreciate you being here with us. We don't want to keep you for an extended period of time, so we got really maybe a couple more questions
Okay.
we want to get in, except for people that might have, something that they want to pose and get answered. So one of the things that I really want to put forth is, in case I missed something, if you could step into my shoes and you could have asked yourself something that I didn't, what would you have asked that maybe I might have missed?
Ooh, let me think about that one. Maybe what has changed with spinal cord stimulation? We've got so many patients who either knew someone years ago who underwent a trial, or maybe they underwent a trial themselves and it didn't work for them. Well, I try and remind patients, like, think about cell phones and how far the technology has advanced. As I previously mentioned, the stimulation we had, 10 years ago was the same stimulation we had 40 years ago. All of these new advancements, so the fast therapy, these different subperception programs that are working very differently on the spinal cord, are relatively new. They're still kind of in their infancy. So I would say give it a shot. What do you have to lose? And just kind of be open-minded and trust that the technology is there, and this could be an option for you now that maybe it wasn't in the past.
Yeah, I would certainly say with the aspect of an advent of fast therapy that's now out there, right? I mean,
Yeah.
there's a lot of things that are constantly evolving in order to be able to get some degree of improvement, right?
Hmm.
And that may benefit patients that really might not have been seen a year ago, 5 years ago.
Yeah.
So there's definitely benefit to neuromodulation. And I really appreciate you coming on and kind of giving us sort of that epiphany, if you would. So where can our listeners learn more about you, Boston Scientific, and spinal cord stimulation? And what are some of the options that are out there for people that are like, well, I'm really not ready to come in. I might want to talk to some people that have had it. Can you give us some idea about where they can get more information?
Oh, for sure. So our website is pain.com. So it's super easy, just pain.com. There's a tab for spinal cord stimulation. Obviously, Dr. Landrum hosts these awesome educational events. He has a quarterly webinar that you can join. He's got his flyers and all kinds of emails that are super informational. I also do Tuesday education classes in the afternoon that I believe are at like 4:30 Eastern time. And that essentially goes over kind of what we discussed today. So the trial, the implant, and then we also bring on a patient ambassador. And what that is someone who currently has a spinal cord stimulator. So it's a patient, someone that you'll be able to relate with and ask him questions about his experience. His name is Justin. So again, that's on Tuesdays in the afternoon. And if that's something you're interested in, we can definitely send you the link to that and get you registered.
Wow, that was a lot.
Yeah.
All right. So as we kind of get into the context of looking at and understanding one of the resources I think you mentioned, so this is pain.com. That starts off with welcome to relief and gives a whole host of different options that are out there that I think you made mention of. And I think from here, you can find a lot of the different resources that you talked about before with having an understanding about where you can be able to kind of connect with patients and things along those lines. We've gotten a few more questions that come in quick. They're not trying to let you go. So look, this is what we got. So one is there 24-hour support?
Yes, there absolutely is. It's a phone number you go home with. But I also want to let you guys know you have our cell phones. So if there was ever, let's say, an emergency, you have our cell phones to contact us. But say I didn't answer the phone, there is that number to get in contact with our patient care team.
Okay. And the other question that's coming in, which I should have asked, I just neglected this, was, is it covered by insurance?
Yeah, so the majority of insurances cover it as long as there's proper documentation. Medicare's great. One step though, and I think sometimes patients are shocked, but it's just one of those hoops we have to jump through with insurance, is there is a psychological evaluation that is required prior to undergoing the spinal cord stimulator trial. And all that is just to make sure you can, you're a good fit for a medical device and that you're able to work the device appropriately.
Okay. Again, Hannah, thank you so much for joining us. For those people who joined late, before we get off, can you tell them again what fast therapy is, why it's so revolutionary, and how it can be able to benefit them as a patient?
Yeah, so fast acting subperception therapy. So the fast form of the subperception programming, brand new as of, a couple of months ago. We just launched it and started using it in the field last month. But it's been super revolutionary in that I am able to, for patients who are a good fit for it, so just know not every patient responds to this, similar to how medication works. Some medicine works better than others. For those who it works for, it works really well for, and we know within minutes. So prior to you leaving the office, we know if this is going to be a good fit for you, and that's the difference with this therapy, is we never had that in the past. We always had to wait those couple of days to see if it would work for you. And since we only have that week to figure it out, being able to offer fast to patients has really been life-changing for them.
Wow. Again, Hannah, thank you so much for explaining these new type of techniques that can help people be able to get their life back, for joining us again to talk about neuromodulation and some of the ways that it can impact people and how it can be able to treat different types of pain. We really appreciate you being here with us. And again, hopefully you may consider joining us sometime in the future if it fits your schedule.
Okay, sounds good. Well, thank you everyone for having me. I appreciate you, Dr. Landrum, of course. And
thank you everyone for joining us, and we will see you next Thursday to talk about another topic and how to be able to punch pain in the face and get back to leading your life that you deserve.
Love it.